Today, we have the pleasure to have Paul and Brian to join us. Paul DeVega is the Senior Project Manager for UCI Health, working primarily on long-range planning and construction projects. His background is in urban and regional planning with over 20 years of experience in public sector planning, economic development, and healthcare project management. He is currently managing the development of UCI Medical Center Irvine, along with UCI Design and Construction Services. And we have our other panelist, Brian Pratt. Brian Pratt is the campus architect and associate vice chancellor for design and construction services at UCI, currently overseeing major academic building projects, research facilities, and housing projects. He leads the design and construction efforts for the campus, delivering highly complex projects via design build. Brian has served in private and public sector, and his work has been recognized with several awards and recognitions, and many projects have achieved leaderships in energy and environmental design platinum certification. Welcome.
Good afternoon, everybody. This is really a pleasure to be with you all. We're super excited about this project for obvious reasons. It's establishing this great new second medical campus in the heart of South Orange County, and really extending our reach out into these areas that are in need of our services. So this is a great opportunity to show and tell, and so we appreciate you giving it to us. So project drivers that kind of led us to making this huge decision to embark on this building of the second medical campus is really in line with our strategy that's been in process for several years now. As many of you might know, we have opened several clinics out in the South Orange County area, extending our reach into South County and making it easier for our patients down there to access our services and access our world-class doctors and facilities and care. This particular opportunity here allows us to have a second medical campus directly adjacent to our main campus, which really, is at the center of our mission as an academic medical center to discover, teach, and heal. We bring all of that great research that's happening at our main campus into our clinical setting, and that integration is really powerful. And I think this will become even more so, having our front door really at the main medical campus. And it also responds to the demand that we're seeing down in South County. The demographics are showing that there's increased demands for these service lines that we're targeting, that I'll be getting into on another slide here. And there's also we've had challenges with patients in South County wanting to for certain services come up to the Orange campus to get care. So we're bringing care to them down in South County, and this is really a response to the needs and the wants of our patients and our down in that area. And obviously it's a huge expansion for our medical enterprise, and having a second campus is really going to propel us into a different kind of growth scenario. So super exciting. The location of the site, from our perspective, couldn't be any better. As I mentioned already, the proximity to the main campus is spectacular. We are right front and center on Jamboree Road, between the 73 freeway to the, I'll call it the west, because in plan view, it's easier to talk about this in terms of plan view, but to the west is the 73, to the east is the 405 freeway, to the north is the 55 freeway, and John Wayne Airport is also directly to the north. So regionally, it's in such a strategically great location for so many reasons, but largely is really access, and allowing our patients all these different opportunities to access this new medical center is just going to be, it's going to be such a great thing. There's really three main buildings that comprise the site. There's the first one that's going to be coming online is right up on Jamboree Road, and it's the Center for Advanced Care, which will be a medical office building, and I'll get into kind of the components of that later. There's also an ambulatory care center and cancer center, which will be directly adjacent to the future hospital. And you can't see it here, but beneath this on the garden level, which you can kind of think of it as a basement level, these two buildings are completely connected in a integrated surgical platform. So we have our outpatient ORs directly accessible to our inpatient ORs, and all of that staff and patient flow can happen at that garden level. So we're super excited. This is something that really sets us apart from others in the region, having this kind of integration all in one site. So it's a great attribute for the project. So here's some specifics about each of these three main buildings. The Center for Advanced Care, partially funded by Prop 3 Children's Hospital Fund, is going to have pediatric and adult services, primary care, specialty care, and, all the way. And some of those examples are the Center for Child Health, which will be the entire second floor, and it'll consist of primary care, multi-specialty care, and pediatric rehab services. There will be a primary and multi-specialty care for adults on the third floor, including the Digestive Health Institute. And on the fourth floor, there will be an orthopedics and neurosciences clinics on the fourth floor. Top floor will be for future clinics and administrative office uses. And and last but not least, there will be an urgent care on site, which will provide after hours care and ultimate access to patients in the area that need same-day appointments. The hospital is 144 beds, including a 22 bay or bed emergency department. There will be a comprehensive stroke center, 8 operating rooms on the hospital side, and approximate gross square feet of 575,000. The ambulatory care center and cancer center, which is directly adjacent, will have an endoscopy center. It will have, as I mentioned, cancer center, multidisciplinary cancer clinics, radiation oncology, and infusion. And we're basically replicating everything we have here on the Orange campus in terms of our cancer services out in Irvine. So it's going to be a very robust offering that we have at that site. Advanced imaging, including nuclear medicine, so MRI, CTs, PET, SPECT CTs, all of that included in one building. And then we will also have a shelled floor for growth in the ambulatory care center. Key service lines that we're targeting are cancer, neurosciences, digestive health, orthopedics, and spine. And once again, this is really, a very targeted approach. We went through a strategic plan that identified those as needs in South County in terms of demographic need, the aging population. All of that is factored into the selection for these target service lines. Okay, and this is where I hand it over to Brian. Brian's going to take us through the design principles and a lot of the cool images and pictures of the project as it's developing. So Brian, take it away.
Thanks, Paul, and thanks for having us, everybody. We're really excited to be here. Good afternoon. So we are really fortunate in that this project not only has an incredible location that Paul outlined, it also has an incredible environment. If you're familiar with the area on the corner of Jamboree and Campus, not only is there a great development of the Jamboree corridor, there is a beautiful marsh that this project sits on the edge of. And so we are really fortunate to have this incredible environment as well as an incredible location. And this environment has really driven many of our design principles. And as we think about the characteristics of a hospital, simplicity, inviting, cutting edge, those are all design principles that you could kind of apply at almost any location. We want there to be clear wayfinding and a way to really comprehend where you want to go in terms of simplicity. We want it to be welcoming and inviting and not foreboding. We want people to feel comfortable there. But on the other hand, it needs to be cutting edge and express that this is the future of medical care and providing the most elite care that you can find in the region. But the site is this incredible natural environment. And we all felt that we needed to be very sensitive to the proximity to the marsh, but also benefit from it by bringing the marsh up into the site and bringing this incredible landscape that we are near up onto the site. And so, we're really excited about these design principles. We basically worked with stakeholders, physicians, staff, and patients, and came up with these 4 design principles that really drive the decision making on the project. And these are really touchstones. As we make our way through the development of the design, we come back to these and test ourselves to make sure that we're meeting our goals in terms of the design principles. Go ahead and advance, Paul. So this is a pretty spectacular view. I hope you will agree. On the far right of this view is the parking structure. In sort of the center where it says UC Irvine Health, that is the hospital tower. And then on the left-hand side is the ambulatory care center. You can see that we've opened up the site for vistas into the marsh and beyond to the university main campus. And we've really wanted to bring the landscape up into this central plaza and make it warm and inviting and a place where people will find respite, also, be able to enjoy their lunch outside, things like that. So on the right-hand side, where it says UCI Hospital, that is the main entry to the hospital. And you can see the really warm and inviting materials that we're incorporating into the design. In the foreground, there's a drop-off, with people. You can see the people waiting for drop-off, an ample drop-off zone. As Paul pointed out, below this plaza is this integrated surgery platform. So below this plaza is a whole floor of complex program that links these 2 buildings together. Go ahead and advance, Paul. So this is the hospital lobby. And, one of the things that we really wanted to benefit from on this site is the linkage of indoor to outdoor relationships. And so on the right-hand side, you can see a stone wall that is the same stone that continues up and through to the tower that you saw in the previous view. Beyond in this view, beyond the reception station, is a gift shop. You can see great clear story windows to introduce a lot of daylight. And then this connectivity to the plaza to the left here is of vital importance. From a simplicity point of view, this pathway straight behind the reception station really brings you to all of the primary public functions of the project, including the cafe at the very end down towards right along the marsh. Go ahead, Paul. So this is the ambulatory care center lobby, and you can see that it's treated very similarly to the hospital. We wanted this campus to feel compatible and comprehensive in terms of its design, relationships, one building to the next. So we're applying, the same kinds of finishes and characteristics. There's also a small cafe, sort of grab and go there in the background. But similar to the hospital, this primary corridor spine leads you to so many of the key functions, public functions, as you make your way beyond the reception desk. There will be opportunities for signage and wayfinding and donor recognition in these areas as well. Go ahead, Paul. So as Paul mentioned, this has an emergency department. And the emergency department, often people come here in a state of mind that is somewhat urgent and concerned. And so, simplicity and direct action and direct interaction is really important in this location. And so outside, there's a very clear drop-off and arrival point, and then you come straight in and are met by the receptionist and check in. The waiting room is beyond. We still have, of course, these incredible finishes and this connectivity to the outdoors as well. Go ahead, Paul. So we talked about the marsh and the importance of the marsh and the arrangements between the buildings. So on the left here is the hospital. On the right is the ambulatory care center. So between the two is a very welcoming and comfortable landscape and plaza environment that can also host events, but hopefully is an area of respite for folks with a wide variety of experiences. If someone needs a quiet area to spend some time on their own, there are certainly areas to do that, but there are also areas to gather and eat outside and hang out with family and friends if you need to. Go ahead, Paul. So as I mentioned, there's a hospital cafe at sort of the end of the walkway, and this is one of the areas where we really benefit from being on the marsh most sort of apparently. The cafe, of course, is an area of high activity for a hospital and high patient activity and visitor activity. So we wanted to really benefit from the wellness and the experience of being outside and connectivity to nature. And so by placing the cafe here, we have these great opportunities to, even when you're sitting outside, look over the vista of the marsh, but also the terrace that you can sit and have your meal and hang out and have the fresh air of the marsh and incredible vistas. And one thing I should acknowledge is the marsh is an area that will never be developed, and so these views will be maintained in perpetuity. Go ahead, Paul. Okay, so this is an overview of the site. Again, this is looking from basically over Jamboree and Birch. And so in the foreground is the Center for Advanced Care. To the right of that is its parking structure with solar photovoltaics on top of the parking structure. Kind of right in the middle of the view is the parking structure for the hospital and ambulatory care center. To the right of that is a central utility plant. The hospital beyond where the hand is waving there, and then to the left is the Comprehensive Cancer and Ambulatory Care Center. So you can see the timing of these. The Center for Advanced Care comes first in early 2023. The Comprehensive Cancer and Ambulatory Care Center comes late 2023. The hospital comes late 2025. So these dates to some may sound more distant, to others may sound really aggressive. I can tell you that they are very, very aggressive. For a hospital project, we work with a state agency called OSHPD, that is the agency that ensures the safety of hospital environments. And so that is quite a process to navigate. And we have a great partnership with OSHPD. And so we're really proud to know that we're working very fluidly and quickly with them. But these projects are a furious pace. We've started construction. The fences are up. The clearing and grubbing for the trailer complex that will house be sort of the heartbeat of the construction zone is going up, and then grading will start really very imminently. So we're really excited to get started on this project. It's large for UCI, of course. It's large for the region, both in terms of scale and in terms of budget. So it's high stakes, and we have a great team working on it to make sure that there's really clear decision making as we go forward. So I think that's that kind of covers the overview of things, and Paul and I are certainly available for questions as you might have. I see some questions coming in on the Q&A. So
Brian, you can go ahead and answer these questions, or I will read off the questions, and then you can go ahead and answer that. We have questions coming in asking if there's going to be any OBGYN or pediatric services.
Yeah, there will not be in this initial phase OBGYN services. There is space for future expansion though. So in the, most likely, in the very near future, we're going to be, this new hospital will be at capacity, and we completely understand that. So we are already planning for the location and footprint of a potential future tower that could include, and very likely could include, OBGYN services in terms of labor and delivery, and other services like cardiac and things like that that are also needed in the region.
Another question, have you completed the EIR sensitivity issues with being so close to the marsh? Can you explain what an EIR is?
Sure. Thanks. And Candace, that's, a great question and a really important one. So environmental impact report, which basically analyzes all kinds of various potential impacts for a project, and really any project, but especially a project of this scale on a location as sensitive as the marsh. We've performed extensive environmental impact report, CEQA, cultural resource review, watershed, floodplain. So we've performed extensive review. There's been a really substantial public outreach for gathering public comments and responding to all the public comments. So we're actually, for a lot of developments, the EIR is kind of a thorn in their side, right? But for us, we really saw it as a real opportunity to really embrace the idea of being close to the marsh and being a good neighbor to the marsh, but also engaging our constituents and the public in the process, and making sure that we are responsive to folks' concerns. So yes, there has been extensive effort on the EIR front, and in fact, we've even worked with biologists at UCI that use the marsh for research to ensure that we are being responsive to wildlife and things like that. We did a bird strike analysis, for example, of the glass walls and facades of the project. We also have a turtle fence up. There are turtles that live in the marsh, and so we have a fence up that deters their ingress and egress onto the site. So we take that really seriously, and like I said, took it as a real opportunity to be very sensitive to this really spectacular location.
Is this going to be a green project? Like with solar, we saw the solar panels and everything else, all the building materials, or will that be more of a toward the green sensitivity?
Yes, we're looking at various levels of LEED certification depending on the nature of a given project. If you know what leadership and environmental energy and environmental design, LEED, L-E-E-D, it's a metric that is used by the U.S. Green Building Council to really measure the sustainability of buildings and projects, and they have several different certification levels. So certified, silver, gold, and platinum, but they also have different categories for the nature of the building, for hospitals and healthcare and things like that. And so, we're striving for very high levels of LEED certification. UCI takes sustainability very, very seriously. We just got our 21st LEED Platinum building on the campus, our new interdisciplinary science and engineering building. That blows the doors off of any institution nationwide. Literally a lot of institutions have, on the high end, 5 or 6 LEED Platinums, and we have 21. So we walk the talk. We are very serious about sustainability, and not only is it a good policy in terms of being a good steward for our globe, but also it makes good economic sense, operationally and physically. So
can I add a little bit to that, Brian?
Please do.
Yeah, I just also want to mention that our central plant is an all-electric central plant. So we are the first, definitely in the UC system, to have an all-electric central plant and not using any gas onto the site, which is huge. You know, if you know that hospitals, they are quite the energy users. So to have an all-electric plant is pretty massive. And we are also tracking towards, we're not 100% there yet, but we're tracking towards LEED Platinum for the hospital. And we feel that we're going to be able to achieve that. And if and when we do, I believe that we would be the first LEED Platinum hospital in the Western United States under the new LEED code, which is a pretty big deal. It's not easy to get hospitals to a platinum level, as Brian was mentioning. So that's what we're tracking towards, and we're really making the push for that designation.
I see a question coming in about the bird strike analysis. Is this an issue? Was the matter of the protecting the birds or protecting people inside?
Yeah, that's a great question. It's for the birds. It's protecting the birds. And there were a whole host of criteria. One was call it the funneling of birds to a wall or an obstruction, which by opening up the sort of open space in between the two buildings, there's no dead end there. And that was one of the criteria. Breaking up expanses of glass so that the reflectivity isn't deceptive to the birds. So once again, this is an area where we worked with our biologists, the UCI researchers in depth to make sure that we are good neighbors for, you know, a really pretty incredible resource for the region, that being the marsh.
I think a lot of us really want to know, when would this project begin construction and how long what is the duration of it? And, you know, I know there's a different completion date, and when it will be the ribbon cutting ceremony, and will we be given an opportunity for a tour?
We would love to host a tour. You know, there will be many tours coming along for a whole bunch of different organizations. And of course, you know, we got to time that correctly with construction efforts and safety and all that. So we would be happy to work through with you a tour. Construction is basically starting now. The fences are up. Grading, rough grading will start very shortly. There is an old building on the site that needs to be demolished. That demolition is basically starting. So construction is starting, and you know, effectively we're talking about more or less, well, help me here, Paul, it's the end date of the hospital is 2025. So, you know, we're talking about construction going on for quite some time, but you know, the CAC, the Center for Advanced Care, and the Ambulatory Care Center opening earlier, you know, those are not only supposed to be completed earlier, they are supposed to be open and operational earlier. So this will not be a, you know, torn up construction site for that whole duration. There will be portions of it that, you know, will be, but you know, it is a relatively long construction. As you can imagine, a hospital tower is a complex type of construction, and so you know, it does take a while to get it built, but the intention is that the Ambulatory Care Center and the CAC are actually operational in those dates that we put up on the screen.
So I believe I saw the date that have the 2023 completion and also the 2025 completion.
That's right. Right.
Okay. Questions on, does your all electric central plant include battery backup?
Paul, do you want to talk about the central plant a little more?
Yeah, so it does. It would be extremely difficult to do an all battery backup just because of the amount of land I think that we are trying to, you know, build here. But we, as is typical with all hospitals, and OSHPD requires electrical generators. So we have emergency generators that will be on the roof of the central plant. In the event of outages, the hospital and ambulatory care center and all its functions will be up and running for a 72 to 96 hour time frame using those backup generators, which, you know, yeah, they basically take diesel fuel, and there's fuel tanks that supply those generators up on the roof of the central plant.
We have a question about mental health center. Is there going to be one?
Mental health services, we have, obviously here in the Orange site. There's certain services that we are providing in Irvine. I failed to mention, and I should have, and I apologize, but the Center for Advanced Care does have an autism center, which we're very excited about. It will have an autism center and an autism garden. It will basically replace our current autism center that's on Red Hill right now, is going to move into the Center for Advanced Care. And in the hospital, there's areas that obviously we have to, not only by code and because it's the right thing to do. In our ED, we have rooms that are specifically geared towards mental health patients. We have separate entrance that's a discrete entrance for mental health patients. But as far as services, in terms of like outpatient services for mental health, not at this time. But as I mentioned, there's future growth opportunities at the site where we've already identified locations where you can have a second medical office building, you can have a second tower for the hospital. So, that's something that's definitely not out of the question.
And we have questions asking when is this cancer center and spine center be completed?
So that would be in late 2023. The cancer center, which is part of the ambulatory care center, which is the building directly adjacent to the hospital, is scheduled to be completed in late 2023. Now, the spine center, orthopedic spine center is going to be in clinics, is going to be in the Center for Advanced Care, which will be online in about spring of 2023. So well ahead of the hospital, as Brian mentioned. These buildings will be coming online in phases. Then ultimately, it will be the hospital that's last in late 2025.
Wow, it sounds really like a very aggressive schedule. Is there anything else that Orange County Realtors can do for you guys?
Well, I would just say that, we appreciate the support. We appreciate the interest. We deeply appreciate the invitation to be able to share with you, a project that we're obviously very excited about, but one that we think is going to have a really meaningful impact on the region and be a really positive addition to this area of Orange County. And we think that it really fires on all cylinders in terms of the mission of the university, the mission of UC Irvine Health. So we're really proud of it. We're really excited to be making progress on it, and going through construction and getting it open.
I actually see a couple of questions in the chat. Is there any sign of hazardous chemicals spillage? And also there's where's the electric power going to come from? I guess someone's mentioning about that, the corner of substation, the corner at the Michelson and Jamboree, and we had heard there were issues, and is that going to be of a concern for you guys?
Yeah, so in regard to soils and hazardous material, hazardous chemicals, things like that, we, as a part of, not only as a part of the EIR, as part of, best practices, we've been very deliberate and detailed in the analysis of the soils and the environment in general, as we are with all of our projects. And so, we continue to, monitor as we grade and monitor for cultural resources and all kinds of stuff. So, it's a very, an issue we're all over and on top of. What was, the electrical power going to come from? I'm not sure what substation it comes from. Do you know, Paul?
Yeah, I think it's a complicated answer to that question. I'm not 100% sure if it's that particular substation or there's a secondary substation that we'll also be pulling power from. We can get back to you on that.
And I just see more question coming in the Q&A. So one question, hospitals are notorious having parking lot issues. Is there adequate parking, and is it parking on the all toll basis?
Paul is probably still trying to make his way to his office through the parking lot, the parking situation at the Orange campus. No, we've taken parking also very seriously and done really extensive analysis of traffic circulation as well as parking quantities. And we think we have ample parking for both the CAC and the hospital and ambulatory care center. You know, they each have their own parking structure and, you know, really quite large parking structures in response to what we've learned about parking over time.
Yeah, and really the location of those structures is just worlds better than what we currently experience. And quite honestly, most medical centers are challenged with this. But our parking structures are really at the front entrances to our buildings. So as soon as you park your car, you're exiting, you see where your destination is versus, you know, for example, in Orange, our parking structure is kind of buried in between a bunch of buildings. You come out of the structure and you really need to rely on you know, signage and to get to the destination point. So it's going to be quite a great experience for both you know, a patient and a staff member to have all that parking directly adjacent to their destination points.
So another question, how's the project being funded, and what is the total cost of the project? How many employees will the project employ? Yeah, we can just answer these. I think you mentioned it earlier, and you can elaborate that a little bit.
Yeah, so you know, the projects combined are north of $1.2 billion. So you know, very sizable projects in the whole UC system. You know, they are divided up in separate projects. The CAC, the Center for Advanced Care, is a separate budgeted project from the hospital and ambulatory care center project. These are there's a whole variety of fund sources ranging from financing to, you know, campus funds to donor funds. You know, it's sort of a mixed bag of everything, and which, you know, at this stage is really common for projects in the UC system. We don't get a whole lot of state funding anymore for our projects, and so, you know, we have to find ways to fund them otherwise. And then I think there was a question about the emergency. Yes, there is an emergency department, and the primary access does come from Jamboree.
So the whole the complex, the main entrance is coming from Jamboree.
Yeah, primarily I mean, if you think about the main entrance, it's Jamboree and Birch. So where Birch intersects and dead ends into Jamboree, that will become the main entrance to really the whole campus complex. There will be a secondary entrance towards the west on Jamboree, but primary access is Jamboree and Birch Street.
So for the emergency entrance, that will be kind of toward the end of Birch or on the Jamboree side?
So you would primarily, one thing to understand is when people are going to the emergency department, they've often never been there before and are in a state of urgency and you know, concern. And so wayfinding and really apparent access and pathways are really important in that situation. And so primarily they will come into the most visible, most apparent entry, which will be the entry at Jamboree and Birch. And then there will be directions to bring them around the parking structure and to the ED drop-off. Will this new hospital have the complete heart department like UCLA and then UCSD?
Complete heart department, is that what you said, Lisa? Yeah.
Right.
Yeah, so we are able to handle emergent cases, cardiac cases. We have the ED is fully equipped with cath labs to handle emergent cases. However, cardiology is not one of the target service lines in this first phase. In the second phase, it's very likely that cardiology will have a big part to play in that.
Will the oncology department and infusion center be in addition to the Orange County and Costa Mesa?
Yes, in addition to.
And the helicopter landing, is there going to be one?
No. So our ED is not a trauma center ED. It doesn't handle the major trauma cases, that where you fly in a patient. That would stay here in Orange, and this hospital will not be equipped as a level 1 trauma facility.
I think that's all the questions we have so far. Any closing remark from you guys?
I do see one other question in the chat about, is there going to be an entrance from campus? We are working through plans to really develop the North Campus and what we call the North Campus on the corner of Jamboree and Campus. And so, we're looking at pathways through from Campus Drive. We wouldn't consider that a primary access, but ultimately where you would come across from campus, you would make your way, and then there's a kind of an intersection as you come in from Jamboree and Birch that we would connect up to. So with that, again, I would just like to emphasize, our appreciation for inviting us here today, and also just to emphasize, how excited we are for this project and its impact on the region. We think that the UC system and UCI in particular, is really laser focused on serving our communities, and we're really proud of what this project is going to be. We think it's really going to be a game changer for healthcare in the region, and we're really proud of it. So, do you have anything to add, Paul?
No, I echo exactly what you said, Brian, and want to extend my thanks as well to Orange County Realtors for offering us this opportunity. Thank you.
Thank you so much, Brian. Thank you so much, Paul. This concludes our webinar today, and have a great day, everyone. Thank you. Bye-bye.
Thank you.
Thank you.